Good morning. To the Physicians Health 2021 Organizing Committee, my name is Associate Professor Dr. Tan Ching Siang. So I would like to present my research with the title Medication Adherence Among Non-Communicable Diseases Patients in a Primary Care Setting. Non-communicable disease (NCDs) is also known as a chronic diseases which have for long-term and are the sequel for a combination of genetic, physiological, environmental, and behavioral aspects. NCDs kills 41 million people each year, equivalent to 71% of all deaths globally according to WHO 2018. In Malaysia, almost two-thirds of the adult population in Malaysia has at least one of three NCDs such as diabetes mellitus, hypertension, or hypercholesterolemia according to NHMS 2015, and also estimated that 73% of the total mortality in Malaysia were caused by NCDs according to this same NHMS 2015. And it is stated that poor adherence in NCDs to recommended regimes result in poor management of the illness and cause more complications. Approximately 50% of the patients living with chronic diseases are not adhered to medications and treatments suggested in developed countries and much lower in developing countries. So the objective for this study is to assess the medication adherence among chronic diseases patients such as diabetes mellitus, chronic kidney disease, respiratory disease, and cardiovascular disease by using a validated self-scoring questionnaire. So for the methodology part, we adopted a cross-sectional descriptive study. So the study population, as I mentioned just now, with this non-communicable disease such as DM, chronic kidney disease, CVS, and respiratory disease. So the location is at this outpatient of a private hospital at Seremban with the 74 participants. So we are using this validated medication adherence rating scale MAS questionnaire developed by Dr. Catherine Thompson. So with this inclusion criteria as stated in this slide, and the study was carried out last year, February to April. So the demographic characteristic of the respondents, so almost equal of the gender for these participants, male and female. And the Malay is the highest ethnic in this study. And for the reported diseases, right, combinations of more than one comorbidities contributed 51.4% in this study. And the average of the illness is about 9 years plus. Okay, for the medication adherence level, so by using this MAS questionnaire, those participants score 1 to 7 will categorize as low adherence group, and good adherence group will be from those score 8 to 10. So we can see that the good adherence participants almost 52.7%. And from here, the MAS questionnaire consists of the 10 statements. So we can see some of the interesting questions from this MAS. Do you ever forget to take your medications? So we can see that almost 60% of the participants answer as a yes. Are you careless at the time of taking your medications? So almost more than half of the participants answer as a no. And for the last question, medications make me feel tired and sluggish. So we can say that we can see that more than about 70% of the participant answer as a no. So the result, the duration of illness was not significantly associated with the medication adherence level in this study. And the various demographic characteristics of the NCDs patients were not statistically significant to the medication adherence level in this study as well. And the conclusion, the low adherence rate was noticed among half of the participants. There was no significant differences of medication adherence level among patients with various chronic diseases. And for this study, ethics approval has been obtained from KPJUC Ethics Committee, and the authors would like to acknowledge KPJUC research grant for this study. Thank you.